As you all know, solid tumors have abnormal vasculatures that cause elevated interstitial fluid pressure, which was shown to be a major barrier to drug delivery. Here our aim was to understand how low-dose photodynamic therapy affected the vascular microstructure and how this affected interstitial fluid pressure and tumor drug delivery.
So there were two major setups in this study. We first used an in vitro model of endothelial cells and pericyte co-culture that we exposed to low-dose photodynamic therapy. In this model, we were interested in the change in cell conformation function of pericytes as well as modulation in their cytoskeletal structure following low-dose photodynamic therapy. We then validated our findings in two xenograft models in mice, where the different molecular pathways observed in vitro were validated in vivo. Also, the spatial relationship between pericyte and endothelial cells was assessed, as well as its impact on tumor interstitial fluid pressure and subsequent drug distribution.
Well, we basically found that low-dose photodynamic therapy had an impact on Rho, myosin light chain, and FAC activation, which are major cytoskeletal regulators within an hour of treatment in vitro and in vivo, specifically in pericytes. We found that this led to cytoskeletal reorganization, which was associated to enhanced collagen contraction capacity in a 3D collagen assay in vitro, and was associated to enhanced pericyte coverage of endothelial cells in vivo. We found that low-dose photodynamic therapy in vivo caused a drop in interstitial fluid pressure in tumors with no change in mean vascular flow, but enhanced macromolecular distribution. Overall, there was an enhanced convection obtained in these tumors.
As you can see on the scheme, low-dose photodynamic therapy has a direct impact on pericyte in terms of activity and structure, which contributes to the stabilization of the vessel wall and decreases interstitial fluid pressure, thus enhancing the convection and distribution of subsequently injected macromolecules.
Thank you very much, and we'll hope that you'll enjoy reading our paper.